KCMX AM 880. Lively conversations around news, politics, and people, plus local news and weather every 30 minutes. Here's Craig.
Do I do when my love is away?
Does it worry you to be alone?
No, no. How do I feel at the end of the day?
Are you sad?
Good morning, welcome back. 17 minutes after the hour, and that's it. A little help from my friends. There you go. Hey, so glad to have in this morning a licensed myotherapist. There you go. Sorry, Teresa. She's a certified nutritional therapist as well, and she's of course, myotherapist, and specializes in massage, body massage, and movement and nutrition, and probably right about there.
There you go.
And, of course, has Rogue Health in town, roguehealth.com. She's over off of Barnett and Black Oak right there. And just profound, we were talking off air about some of, the clients. And, of course, names have been changed to protect the innocent. But how are you?
I'm awake.
You're good. Yeah, you've been
not a morning person.
Well, you're doing just fine. You've been in the studio before and done a fantastic job, and it's always great to hear from you about what you find in what starts out as what would be a simple massage. And we've talked about this in the past. We, as humans, adults, whatever, we just accept what we get and just try to make it work. And we don't take care of ourselves like we should, and that aching pain, we don't think it's much, it'll go away the next day, and it's actually back spasms or leg spasms or muscular, whatever. And months and years later, the doctor's saying, you should have that looked at. And then you hear the story of, wow, a couple of years ago, I should have been. And so you're dealing with the recovery, but also you deal with trauma victims from accidents and car accidents. So that's a huge piece as well. But one of the things that we were just talking about is, as the massage comes out, you find other things.
Oh, yeah, absolutely.
Tell us about what's happening there.
Years ago when I got into this, it was actually kind of more of helping my husband feel better and less stressed and so on and so forth. And it's grown into this just fascinating field. Prime example, some of the training I was going through a couple of years ago, some auto-emotional release. And it's very gentle work. And you're working on the head, and you're working various areas just very gently, just hands-on, and just kind of focusing on the area. One lady, I was working on her neck, and you just do kind of a sweep of, how does the body feel? You rock the head back and forth a little bit. And there was an area that I could feel was tense. And like if you've got a tablecloth on the table, and you stand a glass on it, and then you just kind of tug the tablecloth, and you can feel that there's a pull. And you can do this with your eyes closed. You can feel there's a pull, and you can actually kind of figure out about where it is. And so I asked her, I said, okay, so what's going on with your right leg? And she goes, yeah, I've been having pain there. And
this is, you're cradling her.
You're cradling the head. This is in craniosacral therapy, somatic emotional release. You're cradling the head, and you're just kind of doing a gentle tug, and you're doing a sweep of the body. Just kind of, it's kind of a scan. And you can feel the tug. And so she said, yeah, my knee's been hurting for many, many years. And I said, well, where do you think that comes from? And she broke out crying.
Oh, my gosh.
And I said, okay, you don't have to say anything. She goes, no, this is really profound. I really hadn't connected this. But when I was 8 years old, and she was almost 60, when I was 8 years old, I was run over by a taxi. And I woke up in the hospital next to somebody covered in blood. I was 8 years old. I had no idea what happened, and nobody gave me the details back then. And by the time we were done with that one session, the pain was gone. Now we're talking 50 years later.
Yeah, and why is she connecting the knee pain to the taxi that just came out?
Because when you're touching someone and you're giving the caring environment and you're allowing them to really go deep into who they are and what's going on with them, there's so much amazing stuff that comes out on the table. I mean, just just simply amazing. And that came out of nowhere. And she's like, I haven't thought about that for so long. And all of a sudden, the pain is gone. I mean, it was completely gone. And it was about, on a scale of 10, it was probably about a 4 or 5. So it wasn't horrendous, but it was nagging.
Yeah, just a nagging pain in her knee.
Yeah, in her knee. Yeah.
And you asked about her leg, and she came right out with that story.
I made it okay for her to explore why would that. Same thing, there's another car accident case that I'm working right now where the lady didn't have that great of a childhood, and she's had a lot of disability issues. When you're in a car accident, it can really jolt the nervous system.
Oh, yeah.
And unbeknownst to a lot of people, it can bring up a lot of old garbage.
Yeah.
And
now, I want to interrupt just for a second, because one of the things that came out, my wife was just the guy ran the red light, Thanksgiving, T-boned the car, and she was in to see you.
Yeah.
But interesting, about 3 or 4 weeks later, you found through massage therapy where the seatbelt, the buckle, of course, since she was on the passenger side, it was actually on her left hip. But you found the fact that the bruise was on the left, but there was something going on the right because of the whole seatbelt issue. And you found this, 3 or 4 weeks later?
Actually, it's pretty common. People don't really understand when you're in a car accident, seatbelts saves lives, but they also cause injuries. And so, it's very obvious when you've got a neck injury. But when that's screaming so loudly, you don't really hear the other things that are screaming. Once you get that pain down, then the other stuff starts coming up, and people go, "Oh God, am I going to feel like this forever?"
Right.
And so it's kind of screaming child, loudest child syndrome when one kind of.
Right. The screaming, yeah, exactly right. When there's a group full of screaming
when
kids,
you get one shutting up, you can hear the rest of them. But it's very common that the hips get torqued and you start walking a little differently, and then other pains come up because now your body's adjusting to the new way that it's walking and sitting and sleeping, and so other aches and pains can come up. So yeah, very common. And the other thing that comes up too that people just really don't relate is when your head whips, your feet whip, and so you can get ankle injuries and you are absolutely unaware that it is in any way related. Usually doesn't hit the prescription from the doctor because they don't talk about it. So, but It's very common, yeah.
And of course, with serious accidents, typically, knees are up underneath the steering wheel and the, control, everything like that. So, and ankles as well. All right. So that was just interesting that 3 weeks later, you're finding the seatbelt
That's
issue.
because the neck started calming down.
Right. Exactly.
The neck's the one that,
Yeah, exactly. So back to our story.
Yeah.
Our second individual that car accident.
So she had some problems growing up. She had some disabilities. At one point, she had a baby, and she had horrendous mood swings, and nobody helped her through this. They decided to take her children away from her.
Wait a minute. Were they just thinking that mood swings after her pregnancy or throughout? Or
after she gave birth, there's a post-traumatic or the postpartum depression kind of thing going on. She had a pretty extreme version of that, and instead of helping her and everybody coming to see how we could help her cope with everything, she couldn't really handle her children very well. I think by this time she had 3, and all of them little, and it's overwhelming. I had 2 little ones.
Oh yeah.
Oh my God.
Oh yeah.
And they ended up taking her children away. They were neglected in foster care. That's coming back to haunt.
Oh.
Okay.
Yeah.
And so all of
it just gets worse and worse.
All of this started coming up. Then her relationship started going like this with her husband. And so here I am going, okay, you need to not make any decisions right now. You need to calm down. Let's get this all calmed down. Don't do anything drastic right now. Let's just get you calmed down. And so that's a lot of what goes on the table. And it's not in the script. It's not in the chart notes. But that is what people, and they need to get it out, because if they don't verbalize, if they don't express themselves, if they don't let go of it in some way, it can manifest as disease.
Yeah,
and
emotion, right?
Absolutely.
Move through. But this was in response to massage therapy after an auto accident.
Yes.
Okay, so you just mentioned that what would be now stepping up because of the seriousness and amount of issues that she's got is she the one that's going to have her counselor come in with her as well?
No, that's not the same one.
Different.
Oh, no, I get
different.
so many, yeah.
So this just goes on and on
It
and
goes
on.
on and on.
Yeah.
And it's fascinating work because you get to really touch a human's life in a way that most people won't. And family doesn't really usually understand unless they've been in an accident themselves. They really don't understand what this person's going through. And they're trying to keep a straight face, and they're trying to keep, go to work, act normal, nothing happened to me, la, 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 total denial.
Well, and then you bring in the whole bullying part, and, people make fun. They're so quick to make judgment and make jokes about things when they're really serious. And people get their feelings hurt really easy. So you've got to put a wall up. Yeah.
Yep.
If you're just joining us, we've got Therese Holliday in with us. She's the owner of Rogue Health, roguehealth.com. They're over off of Barnett and Black Oak. And the phone number, 541-727-1996. And, boy, this is just fascinating. We're just getting going with the massage therapy. But physical therapy, chiropractic, the whole thing. Trauma, nutrition is, I know that's huge. You are what you eat, right?
Please remove the Cheetos from your face. Well, and that's the other thing that I have to talk with people about on the table, because when you're overwhelmed by all the emotion, then you start the emotional eating. Yeah, absolutely. And so then it is. Remove the Cheetos from your face, please. Drink lots of water,
Well, and you know what? It's so sad, but it seems like there's so much salt in all of the snack foods. You can be eating a candy bar or even a soda pop and it's got sodium in it.
All the highly processed foods have had the taste basically processed out of them, and so salt is a flavor enhancer, and so there you go. They
cover up with the salt. Now, and then what does that do to the whole
high blood pressure, you name it.
Jeez. We'll talk more when we come back. We've got Therese Holliday in the studio with Rogue Health. Stay tuned. News and weather coming up next. God, can you believe 71 degrees already?
Woohoo.
Back in a minute.
I'm certain it happened.
Stay tuned. Sunrise will return in a moment on KCMX News Talk 880. We want to hear from you. Follow us on Twitter, Facebook, or go to KCMXAM.com and go to the Talk to Us tab. Send us your thoughts. Lively conversations around news, politics, and people, plus local news and weather every 30 minutes.
Going back to my girl. Going back to my girl. Look out!
Good morning and welcome back. 33 minutes after the hour. Hope you're getting going. It's hump day today. Going to be 102, so make it fast, make it quick, and then head for shelter by the time it hits. I don't know if it it was 95 yesterday, cooled off a little bit, cooled off nice actually. It was a great evening, but today we don't know what's going to happen. But I know what's going to happen right now. We've got Therese Holliday in the studio with us, and she's the owner of roguehealth.com and over on Black Oak, and of course she's a certified myotherapist. Myotherapist. I'm sorry, myotherapist. Gosh. Massage therapist.
There you go.
CMT, yeah. And a nutritionist as well. And one of the things we were talking about off the air was some of these things and how kids and with schools coming up, we don't touch kids like we used to. Parents don't touch children and hug them. There's this hysteria now, and kids are, spending so much time separate on the couch watching their program or having their earbuds in, and there's not those kind of hugs and things. You made a comment about that. Yeah.
And in the schools, they can't anymore.
They can't, right?
They can't. And so the less and less that children are touched, that portrays itself in the physiology. And like the Touch Research Institute did a study with babies that were just recently born, and they had a group that they didn't touch, and they just fed them bottles, and there was another group that picked the baby up, cuddled them, and fed them, and there was over a 30% faster growth rate in the babies that had been picked up and touched.
Well, it's huge, and also the whole issue with getting the newborn babies right on the mother's chest.
Mm-hmm.
That's, makes it a big piece.
It's so hard to see that when children are not touched, they act out, and then, gee, let's medicate Johnny. The school shootings and stuff, the stuff that I'm seeing on TV here.
Oh, yeah.
Then they medicate kids, and there are a lot of black box warnings on those medications that make them very dangerous to take or try to get off of. So it's heartbreaking.
Well, it is heartbreaking, and of course you look at the shooters, these kids that decide to act out in a gun-free zone. You go clear back to Columbine, and the teenagers, they're isolated, they're not in reality, and you immediately kind of start thinking, wow, where are their parents? You know, and then you go to the Sandy Hook issue, and there was some disconnect there, and it seemed like the mother was trying to connect with her son via weapons, which was really interesting. Go out on the shooting range and let's hang out together on the shooting range.
Sometimes you have to meet the child where they're at.
Yeah.
Unfortunately, a lot of them perseverate on things that are cool, like trains or guns. And so you meet them where you can, just to try to connect.
Yeah, I mean, you know, we never really knew, of course, and then she was killed in the whole process. So horrible. Well, in your quest for great massage, all this other stuff comes out, and it all makes a difference. I mean, like I said, it's all part of the wheel. You know, it's all like spokes in a wheel. They all matter. And, nutrition, being hydrated, and then, regular maintenance on our bodies and massage. And you had some other notes there that you wanted to talk about.
Well, what I wanted to bring up is that I've been experiencing a lot of clientele coming in the door, whether it's for car accident cases or just trying to get some kind of relief from stress. A lot of childhood abuse issues coming up in recent times.
Yeah.
And so I was talking with a friend of mine who is a psychologist, and she mentioned the Adverse Childhood Experiences Study. And so I pulled it up, and it said the ACE study findings suggest that certain experiences are major risk factors for the leading causes of illness and death, as well as poor quality of life in the United States. Progress in preventing and recovering from the nation's worst health and social problems is likely to benefit from understanding that many of these problems arise as a consequence of adverse childhood experiences. Now that means
they never recover.
They don't. So sexual abuse, physical abuse, emotional abuse, verbal abuse. The list goes on. And she pulled up, I think it was CASA, Jackson County.
Oh, man.
2012, 760 confirmed cases in the last year. That's 2 kids per day. That does not include the ones that do not have enough evidence.
Yeah.
And 2011, Oregon, 74,342 reports. Less than half got...
How many in Oregon again, I'm sorry?
74,342. That was in 2011.
74,000?
Yes.
In the state of
More
Oregon.
than half of them got assessed, or less than half of them got assessed. 23 of them got checked out, 23% got checked out, and 11,599, or 48% of it, were ages 5 and younger. Now this comes out...
Under the age of 5.
And this comes out on my table. And so when someone comes in for a massage, it's not just that. I mean, I hear it so frequently. And, people don't realize what they're doing to these kids, but they also don't realize when kids have been through something, they need to get that help, because if these kids don't let it out, at some point, it will manifest, as the study states, in disease, in poor quality of life, in early death.
And we just had that article that hit, I think it was from the LA Times, it was in our paper over the weekend, about bullying, in elementary school and middle school, comes out as later as adults. Yeah. I mean, it's...
in the whole emotional, in the whole emotional state of, how they feel about life, how they feel about themselves, about work, everything. And then you look at...
You could take one piece, and that would be self-confidence.
Oh, yeah, that alone.
If you could just have the self-confidence issue dealt with, related to kids in school, if they think they can do it, if they think they're as good as the next person sitting over. We've got the whole issue of school starting and school clothes and the comparison of who's dressed like what. I mean, it's horrible to think, and even it has come out, visiting church on Sundays. You used to wear your Sunday best, Well, it's changed so much, but if you show up in a pair of raggedy jeans to church, used to be wow, you need to be excused and go change your clothes.
Mm-hmm.
You know, and it was that kind of issue. Now it's not so much. They just want folks to show up and be receptive and, you know, that kind of thing. But in school, this whole issue of clothing and then, but under the age of 5, it's horrible. It's just disgusting. You know, I talked about this when the Penn State issue came up, and as a society, and we had the gang in from CASA. They're just phenomenal. They do such an incredible job.
Yeah.
But they said wherever children are, there also are the predators.
Yeah, absolutely.
And you know, it's shocking. We have to remind ourselves that wherever children are, there also will be the predators. And it's kind of like, you know, feeding frenzy. I hate to say it, but I mean, what kind of society are we that we aren't protecting the most innocent of our species? It's just.
And I hear a lot of stories too about where some children have tried to speak up and the parents don't believe them. And you know, my husband was in law enforcement.
Right.
Basically, I've been told that the ones that perpetrate are the ones that are well known or family members.
Yeah. Oh yeah. I mean, they and that's just coming out in this Hannah Anderson case. They're talking about paternity. Yeah, but they ingratiate themselves. That's exactly the mode of operate. You know, how they operate. They ingratiate themselves into the family slowly and friendly, and they do all that kind of stuff. And it comes out years later, and they act out, and it's just horrific. And of course, like you're saying, this all comes out on the massage table. I mean, this one patient of yours was 60, and she had a leg.
She was about just under 60. Yeah.
Yeah, and they've been harboring these feelings their entire life. And you wonder, just based off, I mean, just the one piece of self-confidence, whether they tell themselves they can do it or whether they have, because this healthy self-talk or this negative talk.
Yeah.
Wow.
Yeah. And so what I'm trying to say is if you don't take care of it, it will take care of you.
That's it. Yeah.
So.
Roguehealth.com is the way to go. And it has your phone number on there. We can give the phone. 541-727-1996. Yeah, and then just leave a message, and they can get back. And of course, we were talking about health care earlier today, whether or not that's covered by health insurance. I wonder if the new care will cover it or not.
Waiting to hear.
Well,
sometimes it is. It depends on your policy.
Yeah, and it's interesting that now Obamacare, the regulations of the Affordable Care Act, maybe too high enough to bump off some of the smaller policies. We were just talking about 100,000 people in New Jersey are going to lose their plan because it doesn't meet the standards of the Obamacare.
Nice.
So they're having to go shop for other plans, and you wonder where they're going to end up. You know, same kind of thing. Well, so the massage, of course, accidents, key piece, make the call right away. Don't wait, right?
Take care of the earlier you take care of yourself, the less scar tissue can build up, the less emotional scar tissue can build up. Don't take this lightly. I've seen people that come in and I'm fine, and I touch them and they can hardly stand it. And they're like, and I'm not putting any real pressure on them, but their nervous system is so jolted, and I know this, and they want to come in, work deep, and I'm like, no, denial's not just a river in Egypt. Yeah.
Denial, exactly. Well, I've done that. I've said, hey, go for it. You know, I didn't know what I was saying, but yeah. Oopsies. Yeah. But no, rates are very good, and just a matter of calling and getting that in. Wow. And of course,
if somebody wants to find out whether what I can do for them can help them or not, call me, schedule a 15-minute appointment free of charge. I'll talk to you. If I think you'd be better served with a different modality, by all means, I'm happy to suggest other practitioners in the area. I suggest osteopaths and chiropractors a lot, counselors,
right.
And I'm willing to work with counselors and psychologists, together. So whether it be a session with them, a session with me, or whether they come into my facility and we kind of double team it. So they give the emotional support and I give the safe touch, again, going back to childhood
Right.
trauma, I can give the safe touch and I can give the safe environment where someone can feel okay to let it all out, and whether it's scream and cry and swear and call
Right.
names, it doesn't matter to me because I've been through enough stuff in my life where I know that's needed, and family isn't always the place to do it.
Right.
And, doing it behind a steering wheel can get you arrested.
That's right. Exactly right. Well, here's the nice thing about all this is that there's different levels. I mean, you can start easy.
Absolutely.
I know a lot of folks have fear about chiropractic,
Yeah.
and that's changed a lot. They're using a lot of different methods, so it's not the back crack, the crack back, that kind of thing that they're talking about, but that you also have the ability to kind of do light, medium, heavy, or extra heavy on that.
Depending on what the situation is, I try to find out, have you had body work before? If so, what kind? Do you like light touch, medium, heavy touch? The first time I touch somebody, it's not going to go elbows to the
Right,
table. It's
right.
just not. If you've been in a car accident, I try to say, okay, I need some interaction here because you need to tell me whether I'm going deep enough or whether I need to back off. And the other
Right.
thing, too, is people can misjudge and go, I'm fine, go for it. And I've just seen too many people to know that's really
Well,
not what
and-
you can handle right now.
And the muscles don't lie, do they?
No, they don't.
Wow. Well, Theresa, thank you so much for coming in. It's great to have you in on a regular basis because this is just fascinating stuff, especially when you're talking about getting healthy again and getting the most out of your day. Days are so short as already, and not making the most out of your day and suffering through it is just not the way to do it.
Life is way too short to not wake up every day and say, I'm glad I'm here. And if you're in pain, do something about it.
Yeah, do something. Don't wait months or years. I know
Absolutely.
it's shocking sometimes, but we do it. I'm guilty. I am guilty of
When's your next appointment?
That's right. Exactly.
Yeah.
Wow. Well, Therese Holliday with Rogue Health. It's roguehealth.com. Thank you, Theresa, so much for coming in this morning.
And thank you.
Wow. Okay. Well, that takes us to our break. Let's take care of that and come right back. We have so much to discuss this morning. You wouldn't believe it. We're just going to run out of time. So, all right, stay tuned. It's the Sunrise Show on KCMX. Hit us up on our Facebook page or even our website, kcmxam.com. You can find all the links right there. We'll be back in a minute.
Stay tuned. Sunrise will return in a moment on KCMX News Talk 880.